looking at the fetal alcohol syndrome, so it is generally recommended a lady who is pregnant or planning a pregnancy should avoid alcohol. If the lady keeps on continuing using alcohol during pregnancy, it results in fetal alcohol syndrome, which can result in higher chances of stillbirths, spontaneous abortions. And when a child is born, the child may be born with a low birth weight, with microcephaly, that is a small head size, a flat face, you can see the features here, a mental retardation, that is lower IQ, there could be a risk of congenital heart disease, and there could be slow growth. Other features are presence of epicanthal folds, low nasal bridge, minor ear anomalies, a short nose, micrognathia, a thin upper lip, flat midface, and short palpebral fissure. So these all features, they constitute fetal alcohol syndrome manifestations. There are chances of a low growth, a mental retardation or low IQ, along with the risk of congenital heart disease. So long-term effects of abuse of alcohol are psychological dependence, neurological deficit, which could be because of Wernicke-Korsakoff syndrome, Wernicke encephalopathy. There could be alcoholic cardiomyopathy and even pellagra. Now coming on to the treatment of alcohol intoxication. Remember, alcohol is a CNS depressant, but at times a person becomes very violent. When the person has become violent, we can use benzodiazepines to calm them off. Remember, benzodiazepines have a cross tolerance with alcohol, so their efficacy would be relatively lesser. We can use chlordiazepoxide, we can use diazepam, we can use lorazepam, which have to be gradually tapered off. We need to give a supportive treatment in the form of diet and vitamins, and give symptomatic treatment as it is there. For patients who are having alcoholism, that is, who have identified that they are having a dependence on alcohol, we can use what is called as a anti-abuse therapy, which is the brand name for one of the agents, that is disulfiram, which is called as aversion therapy. Now please remember, when we use disulfiram, it can produce a near death experience. So therefore it should never be used without medical supervision. They can produce very severe nausea, vomiting, incapacitating condition. So we generally start with 1 gram on day 1, reduce the dose to 50% on day 2. Then on day 3, for up to next 1 to 2 weeks, we give again 500 milligram, and up till day 15 we reduce to 250 milligram and then gradually reduce it. So basically we are going to taper it off slowly, and remember, it has to be done under medical supervision. The withdrawal manifestations for alcohol include nausea, sweating, confusion, sleep disturbances, tremor. One of the major problems which the people who are abusing alcohol is sleep disturbances when they don't have it. Remember, even when they're using, then there are again sleep disturbances because there are more frequent awakenings. There could be tremors, there could be lack of judgment, pupils would be dilated, there could even be a sixth nerve palsy, nystagmus, and ataxia. In addition to this, it could manifest as fever, tachycardia, hypotension, craving for alcohol, and impaired immunity. In addition to this, there is anxiety, these people become agitated, there could be amnesia, both anterograde and retrograde, which is seen with other CNS depressants also, can cause hallucinations, inability to recognize, even convulsions, and there could be toxic psychosis, delirium tremens, and perceptual distortion. So like other CNS depressants, we have to be careful about drug interactions. As I mentioned, that whenever we use with other CNS depressants like sedatives, hypnotics, opiates, tricyclic antidepressants, phenothiazines, antihistaminics, there is increase or there is supra-additive CNS depressant effect, which can result in motor impairment. But it does not mean that we cannot use this agent. We have to be careful about using sedative and hypnotic, especially when they are in hyper agitated state. When we use alcohol, remember, it causes microsomal enzyme inhibition for anti-diabetic agents. So those patients who have a history of alcohol use or abuse, tolbutamide should not be used. Those patients who are on anti-epileptics, I mentioned that alcohol decreases the seizure threshold. Remember, they also cause microsomal enzyme stimulation, thereby decreasing the clearance of phenytoin, therefore decreases the plasma concentration of phenytoin, which again leads to breakthrough seizures. They also increase the toxicity of paracetamol. Remember, they are causing hepatic damage, and paracetamol is also metabolized in the liver, so one must not use alcohol and paracetamol.